All of us struggle all the time with prescribing warfarin and other vitamin K antagonists. For years, they have been the only available oral anticoagulants, and yet they have so many limitations. Now, rather suddenly it seems, comes the introduction of new oral anticoagulants targeting thrombin or factor Xa that can be given in fixed doses without coagulation monitoring. Overall, the new oral anticoagulants are poised to replace vitamin K antagonists for many patients with atrial fibrillation and may have a role in acute coronary syndromes as well. What a change. But with this luxury and flurry of activity on the anticoagulation scene, it is difficult to remember the nuances of these new drugs and to make good decisions as to when to use them in our patients. If you are anything like me, it is hard to keep all the data concerning dabigatran, apixaban, rivaroxaban, and endoxifen straight. But now there is help in the form of a great and timely review in JACC from the ESC Working Group on Thrombosis, which reviews the pharmacology and the results of clinical trials with these new agents. The paper also gives perspective on their future incorporation into clinical practice, and I won't go into all the details. But here's the example. In the report is a review of the results of phase 3 trials in patients with AF, comparing warfarin with dabigatran at different doses, apixaban, rivaroxaban, and where endoxifen stands in its clinical trials. If you can quote the differences between all these drugs and their bleeding outcomes versus efficacy compared to warfarin, as well as remember all the challenges these new agents pose, I salute you. But for us mortals, this review really helps in that it is remarkably complete. You really don't have to have an encyclopedic memory about these new agents. The report in JACC covers it for you and should be a valuable resource. I'm Peter Block, and this is a CardioSource Heart Minute.